Breaking news that we're going to cover if you are on compound Tirzepatide and you've been following the saga of all of the telemedicine companies, med spas, and even providers that have received cease and desist letters from counsel of Eli Lilly. This video is for you because there's breaking news today. We got a statement from the FDA and we're going to get into it. We're going to get into the implications, what this means. But before we do that, I need you to hit that like, hit that bell, and hit the subscribe button for notifications when we go live, when we make videos, because time is of the essence with breaking news in the world of GLP-1s. If you're new here, drop an N in the chat next to your name. Let me know that you're new here. I'd love to welcome you by name. My name is Dave Knapp. I'm the man on the Mounjaro. That's why I'm here. You are on the pen. Wegovy, Saxenda, Victoza, Trulicity, Mounjaro, Zepbound, Compound, that pen. And we talk about all the news that affects this. You're going to hear it today from On the Pen. You're going to hear it everywhere else tomorrow, over the next week, whatever it may be. But we cover everything as it breaks here. And this is huge. This is huge. So I've been kind of communicating with Madison Muller from Bloomberg over the last few days, been tracking with what has been going on. We've been receiving it On the Pen, many letters that you can find over at onthepen.com from telemedicine companies and med spas and even providers that are getting this cease and desist letter from Eli Lilly. We posted them over there. Today, Madison went in depth on an article on Bloomberg, and we actually got a response from the FDA. Not we, Madison did, Bloomberg did, got a response from the FDA that's going to give context to this. So what's very interesting is up until now, all we had was the Eli Lilly letters to these telemedicine providers, these doctors, these med spas. And basically, in the letter, Eli Lilly's counsel says these drugs are off shortage per this link on the FDA website. And since they're commercially available, you need to cease and desist the sales, manufacturing, and marketing of compound Tirzepatide. So what was really profound about this article in Bloomberg, which covers in depth Zappy Health, which I've been communicating with their owner, who has actually taken Tirzepatide, compound Tirzepatide off of the sort of menu of things that they'll be willing to prescribe to their patients, to their new patients. He's quoted in this article a very, very interesting quote. Let me see if I can pull this up here. But something to the effect of, we're doctors. We save lives. That's what we do. So it's very interesting to see Eli Lilly come after doctors, right? So I would highly recommend you check this article out by Madison. It's linked in the description. We're working with Madison to see if we can get Madison on the pen tomorrow night, because if you don't follow here, hit subscribe. We do a live show every Thursday night. It's called On the Pen Live. We have great guests. Our guest for tomorrow is Zachariah Ritano, Z Ritano from Roe, and he's going to come on and tell us about their new insurance checker, which is super, super cool. But hey, if you're just jumping in here, hit the subscribe button, hit that thumbs up button so more people can get this news. So I want to get, as Johnny says, Dave does an amazing job fighting the FUD, the fear, uncertainty, and doubt that Lilly is sowing for its own financial interest. Interesting take there, Johnny. Of course, one of the things that we try to do here is just give you the news as it comes out. And so the interesting thing from Madison's article today is that we got an actual statement from the FDA. So we already know Eli Lilly's position. The Eli Lilly's position is it's commercially available. We've reported that to the FDA. Now you need to cease and desist your compound sales. Well, I want to pull up the quote from the actual representative of the FDA, because we actually got an FDA response here. Now, to understand this whole saga, you sort of need to go back to my videos on compound pharmacies, why they exist. But essentially, there was legislation in 2013 that established the 503B pharmacy designation, which allows 503B pharmacies to mass manufacture drugs that are in FDA shortage. And now Eli Lilly's taken the position that because we've reported all of our doses as commercially available, they have to stop. Up until today, we had nothing from the FDA until we got Madison's article. So I'm going to read this quote verbatim. This is coming from Amanda Hills, who is a spokesperson for the FDA. And I quote, "The FDA is currently working to determine if the available supply of Tirzepatide would meet our definition of a resolved shortage, end quote. Now, this is the first time we've heard the FDA speak on this, and I find this to be really fascinating because essentially what they're doing is they're taking a much different position than Eli Lilly has taken in their cease and desist letters. Eli Lilly has taken the position, we've reported it's commercially available, now they have to stop. The FDA is going, whoa, we don't necessarily take that same position. We are currently working to determine if the available supply of Tirzepatide would meet our definition of a resolved shortage. So what we don't know in there is what would meet their definition. I think that because there is nothing that seems to be explicit in the law about 503B pharmacies, that it really is up to the discretion of the FDA to determine this. And that's where this could be very interesting. That's where this Exxon case that was resolved by the Supreme Court not too long ago came out, where it said that really the FDA could not or not necessarily just the FDA, but government agencies couldn't just sort of like make up their interpretation of the law. So you can see that Exxon case start to enter into some of this public discussion, whether it's articles from Bloomberg or Fortune or wherever. You may see this enter into it. I'm not 100% sure because I'm as much a lawyer as I am a doctor. I'm a pretendo-chronologist and I'm a faux lawyer, right? I'm none of those things. I am just a guy on the internet giving you the news so that you know how to, approach your conversations with your doctor. Everything we do here is to give you more information, to be more equipped to have competent and confident conversations with your medical provider. Hey, if you're just getting in here, hit that thumbs up button. That'll help other people see this. So basically what we got here in this article from Bloomberg, Madison Muller, linked in the description of this video, is that the FDA is saying, we don't agree explicitly with Eli Lilly's interpretation here. We're working to determine whether Tirzepatide meets the qualifications for coming off of shortage. So that's the update in a nutshell, is that we're not 100% sure exactly how the FDA is going to come down on this. Thank you for the likes. Thank you for everything. But that is definitely positive news if you are somebody who is on compound medication. I've gotten many comments, many emails, many communications over the last few days saying, what am I going to do? I still can't find branded medication. Now, the release the vials, that has not happened yet. Eli Lilly said that that's coming in the future. So anyone who has sort of equated, hey, release the vials is the cause of it coming off the shortage. No, it's not, because they haven't even been released. And Eli Lilly, prior to even announcing that, basically put all these doses as commercially available. Expanded access to both branded medication is something that we have fought for on the pen and we fought for on the community. So that release the vials was a huge win for expanded accessibility to brand name medication, because in an ideal world, everyone would have access to it, right? Obviously, we're working within a flawed system here, a very broken system, but we advocate for accessible medications to legal medications, and so that you can have competent and confident conversations with your doctor to determine what the best course of action for your health is. That's what we do it On the Pen. So thank you for being here. Thank you for being the best part of what we do at On the Pen. I wanted to bring this update to you. Please drop in the comments what your experience with your telehealth companies are. If you're on compound Tirzepatide, has it been affected? If you are on brand name medication, are you able to find it? And of course, if you're making content about dealing with shortages, unable to find your medication, we have to tell our story to the FDA too. So use hashtag report the shortage. Drop that in the comments if you know what the report the shortage campaign. So hashtag report the shortage is what we've been doing. And then of course, you can go to the Row tool at row.co/GLP-supply, or just do a Google search for GLP supply tracker. That's going to help Row to report shortages to the FDA, but it's also going to help you to identify when your commercially branded medication becomes available in your area. So you have to go there and report your shortage. You also have to go there and report when you find the medication, and then you'll get an email alert conversely the next month when the medication is available in your area or not. So that is a super helpful tool. Of course, if you don't want to use that tool, you don't have to, because the FDA has their own version of that tool. Of course, just as a real quick flyover, you've got to make sure that you possess a prescription for the branded medication from your doctor, and that you were unable to fill that medication at a pharmacy of your choosing. That would be an appropriate time to fill out your shortage report with the FDA. Of course, Lilly is reporting the shortage at the manufacturer level, so they don't provide medications to pharmacies. They provide medications to wholesalers. So they're reporting that they're able to fulfill orders that the distributors of their medications place with them. Not necessarily meaning that it's going to be available at every pharmacy, right? Most pharmacies don't sit on $50,000 worth of Mounjaro or Zepbound. They have to order it from their distributor. So you want to see if your pharmacy has the ability to order it, because usually if it's in stock and available, your pharmacy is able to order that medication and receive it within a couple of days. So always want to be on top of all that. I hope this information was helpful for you. Yeah, PBM reform. That's absolutely right, Diana. Thank you all for being here. Thank you for being the best part. Like, save, share this, send this to a friend, share it into a forum that you're in, because this is late breaking news. We got something from the FDA, and I really think that this is a positive development in terms of compound medications, if that is what you rely on for access to medication to fight your disease. Thank you for being here. Thank you for being the best part of what we do, and we will catch you tomorrow on the Pen Live, 9 p.m. Central. We're definitely going to have Zechariah Z. Ritano from Roe to talk about Roe's new medical coverage tool that they have. Is super, super helpful. Way faster than calling a pharmacy. You go, you upload your insurance information, fill out a little bit of information about yourself. They're going to go find the information that you qualify for via your insurance, and then you don't have to spend 30, 40 minutes on the phone with your own insurance company. Of course, insurance companies typically have this baked into their apps, but sometimes it's cumbersome. Super helpful tool if you don't want to deal with the insurance company, right? So thank you for being here. Thank you for being the best part of what we do on the Pen, and we will catch you on the